Perfect. Well, good evening. My name is Gurshay Panjrat, and I'm a cardiologist, and I direct the GW Heart Vascular Institute. And thank you all for coming, especially, as I said, our patients who we are here for, and we are kind of provide this opportunity to participate in their care. So just a few words about the Heart and Vascular Institute. Heart and Vascular Institute was founded in 2001 in response to some of the great work which some of our colleagues have done over the years, and because of contributions from grateful patients. And this is based on 3 pillars of community service, medical education, as well as research. And we obviously leverage excellent clinical enterprise and integrate that and collaborate that among different disciplines in that front. Now, the GW Heart and Vascular Institute has been doing many events over the years, and with including mission work in Honduras, where Dr. Tracy has led the charge along with Dr. Mercader. In fact, yesterday we had an inaugural Women Health Series, a webinar where we had a big turnout and very interactive webinar, and hopefully we'll be doing more over the course of the year. This particular event where you are here today is an inaugural event led by Dr. Mercader and Dr. Choi in partnership with the hospital leadership. Bruno Bretnox is here and others. And this is hopefully going to be an annual event, and especially to celebrate our patients. Again, their stories of their experiences, and hopefully it's going to guide others and in their experiences to improve their life and a better cardiovascular health. Again, thank you. I think you have the program in your hand. I'm going to invite Dr. Petinox, who is the Chief Medical Officer of the GW Hospital, to share a few words.
Thank you so much, Dr. Panrath. Good evening, everybody. Thank you so much for having me. And most importantly, it is the patients and the family members that we're celebrating, as well as all of the amazing healthcare givers that are really behind what is really remarkable success when it comes to the care of critically ill patients. We know that a lot of work is being done around cardiology, and we are very proud here at GW to be in the top 10% of all hospitals nationwide as it comes to the cardiac care, and having earned, for example, the Platinum Performance Achievement Award from the American College of Cardiology really allows us to highlight not just the programs that we do, but also benchmark ourselves and understand from a quality and safety perspective the great work that's being done by everybody. With that, we're using advanced technology really to impact the care of our patients, and being able to deliver that advanced care from cardiology and cardiac surgery to provide for the rescue of the patients. I'm an emergency medicine physician myself as well, and it starts off when we get a phone call in the emergency department about a cardiac arrest coming in or somebody with chest pain. We know that sequence started way out in the field, right, with EMS, somebody doing CPR at the scene, calling 911, and then this continues through the emergency department as then, different teams are activated and different processes are being put in place. That is truly a multidisciplinary approach across the continuum of care, and this is where the highest quality healthcare comes together in a world-class setting that allows us to be successful. I know this evening we're going to hear a lot of amazing stories, but I do want to take a minute also and thank the Women's Board. The GW Women's Board, a philanthropic organization since 1898, is really focused on education and bringing back to the community. And through the Women's Board, we've been able, through the golf tournament, for example, the charity golf tournament that we had, to help make some of these events successful, and it's really helpful. If there are any members of the Women's Board that are here tonight, I'll ask you to stand up and be recognized. I guess we don't, Terry, so thank you. But nonetheless, we are very fortunate for their generous support. We also know that February is Heart Health Month, so we are celebrating in many ways, not just this event here tonight, but also as a reminder to the general public that heart disease is very common. We know about 52% of baby boomers will develop heart disease at one point in time. And here at GW, in the last year alone, we've seen about almost 2,000 cases when it comes to advanced interventions due to heart disease. So we're very proud to serve our community. We're very Grateful to our dedicated physicians, advanced providers, practice providers, our nursing staff, and all the continuum of care that takes care of our patients. And most importantly, we celebrate and honor our patients here tonight. So with that, I'll turn it over to Dr. Choi for some additional comments. Thank you so much.
Well, thank you, Dr. Pandrith and Dr. Petno, for your leadership and your remarks. Well, let me give a little bit of comments myself. In the Malcolm Gladwell book, Outliers, Malcolm writes about stories of success outside the normal. One such story is the Rosetto mystery. This is about the Pisani, or the countrymen, in Rosetto, Italy. In the 1950s, prior to modern cardiology, the Pisani were observed to live exceedingly long lives and with rare rates of heart attack, 50% lower than the United States as a whole. The researchers at the time looked exhaustively at the genetics, the behavior, and the town infrastructure. They looked at everything. This place lay outside everyday experience. The entire community, culture, diet, structure, and ethos was oriented towards heart-healthy survival. It was an outlier. Perhaps if all of us could simply whisk ourselves away to an idyllic, sun-soaked, red wine, dark chocolate, sun-abundant Italian villa in the midst of winter, we could all lead just exceptional heart-healthy lives like these Pisani. Wouldn't that be nice? Well, I'm Dr. Andrew Choi, cardiologist, a professor of medicine here, and I lead our imaging and non-invasive cardiology. And it's through this lens I'm direct witness to the effects of heart disease. Unfortunately, in 2026, the statistics remain sobering. According to the American Heart Association, over 915,000 lives are lost yearly. Heart disease continues to claim more lives in the United States than all forms of cancer and accidental deaths, the number 2 and 3 causes combined. The overall survival for out-of-hospital arrest remains less than 10%. Cardiac event survivorship in and of itself is an outlier. To understand cardiac survivorship, we must look beyond statistics alone. We are here to celebrate the outstanding outlier patients who bucked statistics, survived, and are now thriving. Your courage, it's your courage, is an inspiration to all of us and to all the patients here in the DMV. In this first annual Cardiac Survivors Day, may all of these stories bring new inspiration in this American Heart Month. We welcome leaders from the emergency department, critical care, nursing, anesthesia, general medicine, our labs, our trainees, administration, the Women's Board, as well as our friends and family and the community. We hope that these stories save future lives through awareness and education. GW here is our Rosetto, our outlier. It's not a mystery why, it's because of you. GW is the place where we make outliers the expectation in exceptional hope in cardiac care, survival, and prevention. We'll hear today from the patients all cared for at the hospital here at GW and longitudinally for several years in our outpatient GW practice, followed by the treating cardiologist. At the end of each story, we'll present each patient cardiologist dyad with recognition and as a representative of the entire team throughout that chain of care. And importantly, at the end of our time, we will invite all that were involved in the care. I see Dr. Steckler here from the emergency department for photos as well as conversation in our reception at the end. Big thank you to Susan Duberstein of our Heart and Vascular, Terry Capshaw and her team at the GW Hospital, and Ann Banner and her team at GW Medicine for their leadership and support of this event. And also, as Dr. Petna mentioned, a big thank you to the GW Women's Board for their support of this event over the last couple of months through the charity event, and also my colleague in planning this, Dr. Mercator. And so with that, let's hear from our patients. Let me introduce our first dyad, Ms. Delia Somerville, with Dr. Mazzari. Ms. Somerville, if you can come up. She's a woman who had collapsed suddenly several years back from cardiac arrest at the U.S. Capitol. And Dr. Mazzari is a professor of medicine, our director of interventional cardiology in our cardiac care unit at GW Medicine. Ms. Somerville.
Thank you for having me here. Do you want me to start with sharing my story?
Yes.
Okay. And I hope Dr. Mazzari will join me here soon, too. Yeah, like Dr. Choi mentioned, my story was pretty dramatic. So a little over 4 years ago, I was on my regular run in Washington, D.C. I live on Capitol Hill, so I was on my regular run. It was dark. It was very early in the morning, and I was running with a group, but at that time, I was alone. So at some point, I was on the ground, and my heart stopped. So I went into cardiac arrest while on my run, while alone, running in the dark. So I was very fortunate. There was another runner that early in the morning, happened to be a Congresswoman, Vicky Hartzler. She saw me, she found me, she alerted Capitol Hill Police. They started CPR, they brought AED, and they restarted my heart. Then fire and EMS came, and they took me to GW. And I wasn't even a patient at that point. I was GW Santa Fe. I didn't have a name because everything happened so quickly that even though I was with a group of people, nobody knew this happened to me. So just really seconds, minutes. I think by maybe providence, Dr. Mazzari became my doctor before I even knew she was my doctor because I was out for 3 days. I was unconscious for 3 days. But she became my doctor in emergency room, and I'm really grateful for that. So that was, I think, something else positive in my story, finding my cardiologist in the ER.
So I have to say that your story challenges many assumptions about who's really at risk for cardiovascular disease. Because I have to say, as much as I advocate for cardiovascular disease in women, when I first saw you in the emergency room, I was a little surprised, to a point that we even questioned whether the cardiac arrest had a cardiac etiology. I never thought of you as somebody with premature coronary disease, but that's really what it was, and you didn't know about it. You were doing all the right things. You were running. You were doing all the healthy things. You did have elevated cholesterol, but that was not really taken seriously because you were a young woman who looked extremely healthy. So that's number one. It challenges the misconceptions of who's at risk. The general misconception is that older men are the ones who suffer from cardiac disease, but the number one cause of death in women is heart disease. And it's particularly under-recognized in younger, healthy-looking women, just like you. So that's the core of the story here, is that there were opportunities prior to your event to aggressively modify your risk factor, which was the elevated cholesterol. But that's really the only thing we found, even in retrospect. So nobody's safe. Younger women with, now we know of some female-specific risk factors should always be screened for coronary disease. And then after I first met you, of course, you were unconscious for a few days, so my only point of contact was Patrick, your husband. I think it was during the days of COVID where we were all alone. I was alone, and he was alone, and so we got through it together. And if I were to divide your care in the hospital to 3 stages, it was the phenomenal work of the emergency room staff to get you stabilized so that we can start taking care of you. Then it was the emergent coronary angiogram that we performed to identify what the cause of the cardiac arrest was. And I was surprised by what I saw because, as I said, I didn't expect it. And then it was the teamwork, the village that comes together and works 24/7 to make sure that we get you through those first few days of critical illness, communicating with the family members, trying to come up with the treatment plan, until you were able to join us. After 3 days, you were extubated, you were totally awake. And then we had to come up with the treatment plan and what the best strategy was moving forward to address all the extensive blockages you had. And then, of course, it was the operation and then the post-op recovery. There's so many different layers to your story. It's just amazing. But before we talk about the hospital stay, let me just applaud the care that you received in the field. I think your story has obviously a big medical care component, but upfront what happened while you were running really speaks to the call for action in the community. It's really a community awareness story. The fact that the bystander started the CPR, the fact that AED was used in the field, and how quickly the team mobilized your arrival to the emergency room. So it's just a fascinating story that sums up everything that we do every day, and how everybody needs to nail it in the head for somebody like you to survive, and then become an advocate, which we'll get to at the end. I was just curious, from what you remember from your hospital stay, what really stood out? Which part of that story is something that you think about once in a while?
No, I think it's a good question. And if I go back even before the hospital, you're absolutely right. It's amazing as I became conscious, and I still to this day, I think I'm putting my story together depending on who I'm talking to, because I still don't think like I know everything. But it was a whole community of people helping me without even knowing who I was. So yeah, it's pretty amazing. It's a whole community starting in the field. I would say in the hospital, the same feeling, I think, carries on. It was post-COVID, or still COVID, I think, so nobody could visit me. So it was just my husband, Patrick, who was there, and he had to be, mom and dad and caretaker and everything. Yeah, I was most of the time I was alone. And I think it's the people around me at the hospital that stood out. It's the nurses, it's all the health professionals that came to see me. It's the conversations I've had. It's, the heart pillow that was given to me and somebody signed it. I still have it. It's in my son's room. It's, the books I talked about and lots of random, topics I discussed with the health professionals. But it's the people, because that's what makes difference. And again, that sense of community, I think, carried on.
So a lot of times we talk about what we do for the patients, but we don't often talk about what the patients do for us. And I have to say that, I don't really consider you my patient. We're friends now. And I sort of watched you survive, recover. Then you finished your PhD, you're Dr. Somerville now. And you became a very serious advocate. Can you tell us a little bit about that?
Thank you, yes. And I think it was almost like an easy decision. It wasn't even a decision. Like, what happened to me, it was pretty dramatic and pretty traumatic. But it's also gave me a purpose. Like, it's just, I'm generally a private person, but when I was asked if it was okay to share my story at the recognition event for first responders, I didn't even have to think about it. Like, I said, yes, of course. Like, yeah, absolutely. So yeah, I think it's, it was not even a decision. It came naturally. I think what happened for a reason, and it just gives you purpose to advocate for things like CPR, like AED. So if it happens to somebody else, they get the same outcome, and that's not the case. As you said, I'm 1 in 10 people that survives out there in the field. It's only 1 in 10 people, and I'm that person. So we should change that. And I think also depending on where you live, depending on your zip code, area code, and whether you're a woman or not, you may not get the same care out in the field. So CPR, AED, but also women heart health issues. So I'm also a big advocate of that.
What would you like to see change as a result of your efforts and your advocacy?
I think, yes, access to CPR, access to ED, everybody needs to know, hence only CPR, and everybody should have access to AED if there is a need, whether it's school or public event or anywhere, really. So again, they can have the same outcome I had and the same chance to live I had. So that's first. And I think on women heart health issues, very often, and as I'm sharing my story, I hear so many stories back. There are so many stories of women, particularly women of color, where the signs and symptoms are not seen. And now looking back, I think my signs and symptoms were there too, in addition to cholesterol, like when I was pregnant, and you know, there were signs and symptoms, thinking back. But women are not taken seriously, or they're not being seen as heart patients. Well, it is number one killer of women.
Absolutely.
And why are we always surprised if we see women with heart disease? So I think we need to change that as well, that whole conversation. On the patient side and on the care side and on the prevention side, like at each level, I think we need to look at it differently when we talk about women.
I think you nailed it in the head. So the issues are twofold. It's that women don't think they have the heart disease, so they don't take their symptoms seriously. And when they do, there are also shortfalls on the caregiver side. We don't really think of heart disease in a young woman. So there are really ample opportunities for education and advocacy, and I am incredibly proud to be your physician and your friend, and it's been an absolute pleasure to watch you and your family get through this and really excel and become the sources of hope for other patients, for humanity. So thank you so much for being here. If anybody has any questions for Dr. Somerville, please. Great, thank you.
So, Ms. Somerville, we'll do this now. So, this reads, this is a celebration of courage and care, and so for demonstrating courage in the face of adversity from Heart and Vascular Institute and GW Hospital. And so, present that. Yep, for you. Where's Mazzari? Yeah, Mazzari. Then we'll get other members of the team at the end. Okay.
My fingerprints on that.
Yeah, you go here.
Yeah, hold it. You can hold it. I'm gonna leave it.
Okay, thank you. Thank you, Ms. Somerville and Dr. Mazzari, for that really inspirational story. Our next dyad, we'll hear from Mr. Maurice Montaldi, and a man who had suffered from new chest pain and a sudden heart attack, and Dr. Jonathan Reiner, who amongst many leadership roles is a professor of medicine, director of our cardiac catheterization laboratories at GW Medicine, and in many roles here at GW. And so Mr. Montaldi and Dr. Reiner.
Good evening. I suppose I should start with my dismal family history. Both my father and his father died from a heart attack at a very early age, their late 50s. My grandfather's death in the 1940s was sudden, but my father was in fact being treated for heart issues at the time of his death, and in fact had undergone a mitral valve replacement a few years prior to his death. I suspect that 30-year time span and my father's active cardiac treatment, as compared to his father's sudden death, reflects an early evolution of cardiac medicine at the time. In any event, sometime after my father's death, upon the advice of a doctor acquaintance, both I and my then 8-year-old son were tested for cholesterol and were found to have highly elevated levels. We both participated in a then somewhat novel study group and treatment program at Johns Hopkins, but our cholesterol levels nevertheless remained elevated, highly elevated. I should note that as a result, we developed a sensitivity to dietary restrictions, but candidly, we were not overly fastidious about them. Frankly, our thought at the time was that our cholesterol condition was due to the fact that our bodies were manufacturing excess cholesterol, more so than dietary considerations. In hindsight, I might reconsider that approach to diet. Please understand, it's not that we ate wildly or our diet was awful, or that we ate with abandon, but we certainly could and should have been more sensitive to dietary considerations. In any event, life continued on without any particular medical issues until I developed hip issues somewhere around 2015, which made it difficult for me to walk any distance and otherwise perform normal day-to-day activities. I underwent a hip replacement in 2018, but I still had difficulty walking any distance as a result of leg pain in my upper thighs. For example, walking through the Atlanta airport was absolutely out of the question. But even walking to the car in a parking lot presented issues. So at some point after the hip replacement, I started to develop chest pains after eating and engaging in any modest physical activity, such as walking to the car or going up a flight of stairs. The chest pain would subside if I sat up in a chair for a few minutes. Lying down absolutely exacerbated the pain. And I didn't know whether the pain was just heartburn or cardiac related. I should note that I was seeing a cardiologist regularly at the time and was taking a statin and Repatha, but the heartburn versus cardiac enigma continued. That is until the famous cardiac event of February 2023. My wife and I were having dinner at about 6 p.m. at home, and while seated, I started to develop what I thought was heartburn, but it became increasingly more painful. I moved from chair to chair, trying to sit up straight and ease the pain. My wife even dashed out to CVS for some heartburn relief meds, but the pain continued and intensified. After foolishly resisting my wife's suggestion that we call 911, I finally relented at about 9 p.m., and I remember being placed in an ambulance, taken to GW Hospital, and I further remember being wheeled into the emergency room and lying on a gurney in a bay until Dr. McIntyre, the ER physician, came by holding a computer printout and advising that the computer confirmed his initial diagnosis of a heart attack. Now, frankly, I really don't recall much after that, and for days after that, except for some vague and intermittent recollections of the cardiac ICU. And I have to defer to my wife's copious notes and Dr. Reiner's report, of course. Suffice it to say, I myself was out of it and had no real understanding of the gravity of the situation. Dr. Reiner successfully performed 2 stent insertions that night, as well as a critical valve replacement a few days later. I remained in the hospital for a total of 18 days, including rehab. I returned home and recuperated at home with some therapy and without incident, and in April of that year, returned to my office as general counsel for a local real estate company. But I decided to retire at the end of 2023 simply to slow down and smell the roses. Dr. Reiner inserted a third stent in early 2024 after that heartburn feeling resurfaced. And things had been well heart-wise since then, but the leg pain continued when I attempted to walk any distance. In the spring of 2024, upon Dr. Reiner's referral, Dr. Serene here at GW performed an angioplasty procedure on each leg to promote blood circulation. It seemed to work for a time, but the never-ending saga continued in that a previously existing arthritic condition in my right knee continued to deteriorate. I was ultimately walking with the aid of a cane and was considering knee replacement surgery at another hospital, and I mentioned that to Dr. Serene when he suggested that I have the surgery done here at GW because everyone knows you're here. I followed that wise suggestion, and the knee replacement surgery was performed by Dr. Sterling here in June of last year. So here we are, here I am, and in a sense I think words are superfluous in that the fact that I'm standing here says it all. And while perhaps not yet able to walk through the Atlanta airport, I am walking the block, I'm exercising daily, and at 78 years of age, I really feel that I'm the healthiest I've been in years. I am not unmindful of the fact that, in addition to a bit of divine providence, I owe much of that to GW Hospital and its outstanding physicians, particularly Dr. Reiner, as well as to its equally outstanding nursing staff, particularly the cardiac ICU nurses. I think my cardiac treatment reflects a further evolution cardiac medicine by biblical proportions since the death of my father in 1978, and I am forever grateful. Finally, I'd like to give a shout out to my wife, Tony. She was an absolute trooper throughout the event and subsequently. A lot of lonely nights here at the hospital, a lot of long walks home after cabs became scarce, and a boatload of support since then, and continuing to today. I could not have done it without her. I am forever grateful. Thank you, Sweets. Thank you, Dr. Reiner.
You're a very difficult act to follow. You know, I run into people, sometimes when I'm out and about with my wife, I run into a patient who, you know, thanks me for doing something, and I say, oh, wow, you look great, and wow, look how great you look, and we part ways, and my wife says, you don't know who that is, do you? I said, no, I don't. But I remember everything about the night you came in, because you were about as sick as a person could be. And I want to amplify something that my colleague, Dr. Mashari, said is, if it takes a village to raise a child, it takes an entire medical center to take care of a sick person, you know, like you that night. And it does start in EMS, and it then continues, you know, into our, you know, fabulous, you know, emergency department. And every person that touches you, you know, becomes now part of your recovery. And one thing that stands out to me from the night that you came in and you were in the cath lab is you were so sick and struggling so much. I remember actually having to hold you down onto the table until we get you sedated and get anesthesia there. And I literally remember actually multiple people, including me, lying on top of you to keep you safe. So, and your recovery is not a result of any single person. It's a result of an amazing team. And I've been here for a very long time. I think in this room, I have been here the longest of anyone in this room. Even you, Bruno, I think. And yeah, even Dr. Lucas. And the reason I've stayed is that I work with the greatest people. I work with the greatest people, and the work we do is so relevant. There's a saying in my faith that to save a life is to save the world entire. And because you have your own world and people that love you dearly, and that those are like ripples in a pond, and they keep amplifying. So there's nothing more important to me than to see a patient who put their complete faith and trust in our team do so well.
And I do it again.
It's the most important. Trust is really the most important to a physician or any healthcare provider. Let me ask you a few questions, yep. And then you can ask me questions. So you were sick that night, and what was the first time you actually remember an event from that night? Because you were out for a couple of days.
Yeah. Oh, it was weeks after. As a matter of fact, I remember coming home and for 2 weeks not remembering things, and I thought, is this a permanent condition?
Yeah.
And it dissipated, but that was scary, actually.
Yeah. So you had two problems. You were having what would have been a fatal heart attack, and we stented a critical part of your heart, but we also found that you had a heart valve that was critically ill, which was compounding the problem. And I remember that at the end of your first week, we had a lot of discussion internally about whether we could or we should just replace your aortic valve, and it was not clear whether you would how well you would do with that. And I remember talking to you in the morning, and you weren't on a respirator, but you had a face mask on. You were getting like 100% oxygen and struggling to breathe a little bit. And then you had the valve replaced that day, and I remember coming back before going home that night, and you were sitting up in bed eating chicken.
That I don't remember, but
I remember
sounds
that.
great.
I remember that because when there are, oh, you want me to use the mic? Okay. Because there are moments that tell you sometimes when, I'm sorry, I'm not used to speaking publicly. There are moments sometimes where you worry about a patient, and then there are moments, sometimes very small things that tell you that a patient's going to be fine. And that night, seeing you both in the room with you literally sitting up and cutting chicken, so basically for the first time back as a person that week, told me that you were going to be just fine. Sometimes after one of these life events, things change. You see things, people see things differently. What changed for you?
Oh, well, again, I was in the active practice of law at 76 years of age, and going strong, and I just decided, again, at the end of 2023, that I was going to retire for no reason other than to slow down and smell the roses.
Yeah.
And I'm glad I did. I'm still seeking those roses, but
Well, you got sick over Valentine's Day.
yes, indeed. It was the 13th, going into the 14th, yeah.
Well, there are your roses. I'm glad you're here.
Thank you.
Any
I'm glad
question?
I'm glad I'm here, yes. Thank you.
My pleasure.
All right, Mr. Montaldi, this is a celebration of courage and care, Cardiac Event Survivors Day, February 19, 2026. For demonstrating courage in the face of adversity, Mr. Montaldi.
Thank you so much. Thank you.
Another one? Yeah. Thank you.
Thank you so much.
Don't trip on these wires here.
Because, thank you.
All right, and again, we look forward to see our critical care team here, and so we'll have everybody up at the end, just to have everybody participate and get some photos of me recognized. Well, thank you, Mr. Montaldi and Dr. Reiner. I'm in tears just hearing the stories and also just the care that you can see for one another and your wife, Mr. Montaldi. Our last dyad is Mr. Stephen Hayes. Over a decade ago, he had collapsed suddenly from an arrhythmia. And Dr. Cindy Tracy, our fearless cardiology leader, she's the president of our hospital medical staff and our division director here in cardiology at GW. So Mr. Hayes and Dr. Tracy.
Hello, everyone. Let me tell you what, there are two people or two entities that I thank for being here, God and Dr. Tracy. Because, again, 12 years ago, I died of cardiac arrest. I was dead for over 23 minutes. I was down in Florida with a client of mine. He flew me down there to train his godson. That evening, we were going to go to the football game. But apparently how God works in mysterious ways, it started pouring down raining. So if you're in Florida, you know good and well, it's worse than the traffic here. Well, anyway, all of a sudden, we decided we were going to challenge each other in a game of solitary. So this is what happened. I have no memory, but I played the game and I handed it to him. And all of us, but he told me this. He said a split second later, he turned to hand it back to me. He said, my eyes rolled back in my head. He said, I gave this one last gulp of air. And he said, death has a monstrous sound. He said, I hit the floor, and then that was it. I was down in Fort Myers, Florida. Now, and again, is that I have no memory of anything. I mean, I really don't, because from what I can understand, Dr. Tracy and everybody tells me you have 18 seconds to 2 minutes, and I was gone for over 20-some minutes. And then from there, my client flew my kids down. As a matter of fact, I showed Dr. Choi the video. They videotaped me because I'm under all of this stuff in my chest, throat, and everything, because they said they flew my kids down to take me off of the ventilator, because they said that I would be a vegetable like that all my life. Well, my daughter told me, she said, you don't know my dad. So my dad will be back. And next thing I know, and this is one quick story, I told them, everyone, there is another realm we go to. My oldest son, he was killed in 2013, and he was 32 years old. When I was in my coma, he was at this edge of the bed. He comes up to me and he said, Dad, he said, and I'm in my coma. He said, Dad, he said, everything else is going to be all right, and it's not your time yet. And I showed them the thing. I woke up out of the coma. And from there, I was, from coming out of the coma, I was paralyzed from the neck all the way down. I mean, I asked Dr. Tracy about that. She was saying that the medicine that they gave me had stopped my body, because they hadn't put this defibrillator in yet. And matter of fact, it was like a week that I was there that they put it in. And so I've come back from there. And the funny story is that when I came back, my mind was telling me that, say, you know what, you used to exercise. That's, I mean, really, I couldn't. So I decided, little things started coming back. I came back, and I was riding my bike one day. This is how I met Dr. Tracy. All of a sudden, I was riding my bike in Georgetown, and I was getting ready to go up that hill, and I felt my left leg getting numb, very numb, and my heart started racing, because my medicine I hadn't met her yet. So, so I went to again, this defibrillator went off, and let me tell you something, this thing threw a shock at me like you would not believe. It not only did it knock me off my bike, but the electricity I slung the bike, because then I could see sparks. So I came down here to GW Hospital, and I'll never forget one of the doctors, I said it felt like a mule kicked me. And so next thing I know, I was getting this call, so you're going to go see Dr. Cynthia Tracy. So it's 12 years, and we're doing it all. So Dr. Tracy, she's the one.
This guy, I mean, just look, there's nobody who should have a cardiac arrest less than this man. Look at him. I mean, just really, look. You know, really, this is a perfect case of somebody who survived, who shouldn't have survived, because he was dead for a really long time. And you may not remember this, but you were a little bit whiffy when I first met you.
I had no idea who I was.
Yeah, right.
She had to remind me. I mean, really, not seriously, I'm telling you.
Right. He had a lot of anoxic encephalopathy, which I was happy over time to see that resolve, and then to get to know this man, who he really is, this really a professional athlete who, from time to time over the last 12 years, has tried to get me to do some exercise, but it hasn't worked apparently. But what is different from the other folks that you've heard talk tonight is this is a person with a hereditary type of heart muscle disorder that puts you at risk for sudden death. And it took a little minute to figure out that you do have hypertrophic cardiomyopathy that we treat now very effectively, I think, over the last 12 years or so. And it really went into some explorations as to, what are the implications for this. But I think it's been an amazing journey from meeting you at a point where you really were not quite there to a man who
Crazy.
to a man who has now regained complete 100% functionality. So what do you think about that?
Oh, look, I'm happy to be here. I've never been dead before, so I had no idea. But the funny thing about with Dr. Tracy, because I stay in AFib, about 100% of the time?
Roughly 100, yeah.
About 100, but more than that, it's certain times of day, because I still run track. I still do the 100 meters, 200 meters. So when I would see Dr. Tracy, and the chart, she would look and she would say, when we first started, she said, your heart keeps going into AFib. And I said, what time of day is it? She said, about 2 o'clock in the day. I said, that's when I'm training. And so, everything was like that. So when I would go to see her, and the other people, her staff would come in and they would look at the chart and they would see I was in AFib, she'd have to tell them. She would say, no, that's him. He's going to be like that. It's not affecting him that much.
What do you think about the impact of this? You told us a beautiful story about your son. What about the rest of the family? What do they think about all this?
They don't talk about it much, because you got to remember, my kids, they saw me, in that state, and they were told that I wasn't going to be around.
Yeah.
So
Yeah.
So they really don't talk about it. It depresses them, because they say, hey, my dad's been my hero. So. No, but everybody else does. Other people will, because one thing I learned, though, is that they told me I was my magnesium level had dropped so bad, and my body, there was no electricity in my body. Now, Dr. Tracy also was telling me when she's done something, my left ventricle, which one is it, right or left?
Left ventricle.
Yeah, it's only functioning.
Well, it's a little bit messed up. It's a little bit too thick. It's a little bit, yeah.
That's the medical report. It's
Yes.
messed up.
This is how technical we get in the arrhythmia clinic. It's messed up.
I love what she does. She gives me the simplistic answer. Forget the polysyllabic answers. She say, look, man, you messed up, man.
This is how we've gotten through the last 12 years.
12 years. Can you imagine that? I haven't been with a girlfriend for 12 years. 12 years, man. 12 years. I'm telling you, but I enjoy it. I told a quick story one time. When I first met Dr. Tracy, one of my favorite movies is, well, first of all, I'll tell you, before I say the favorite movie, I was asking Dr. Tracy, I said, Dr. Tracy, I said, so when I slipped the surly bonds of earth, and I said, did they take that needle and hit me in my chest with that needle? She looked at me, she said, you've been watching too much of Pulp Fiction. I said, I had no idea. You remember that? Yeah,
I do remember that.
That's when I knew, I said, this is the person I want around me. A sense of humor, I said, but more than that, I was depressed for a year, because they had told the doctors, they said because I'd been gone for so long and lost so much oxygen to the brain, that depression was going to take me out, or I wouldn't have lasted that long. But something kept telling me, say, no, that's not going to happen. And so I'm still hanging around.
Not only are you still hanging around, you completely got over the brain damage that you had. You completely got over the depression that you had. You returned to being an amazing athlete and a total inspiration to so many people, including me, and the staff that take care, all the folks in the clinic, and Kay and Kevin and everybody else.
I have fun with my enjoy. You enjoy going to the doctor, the hospital, because I like the people there. And like I said, I'll be 74 years old in August, and I'm so happy to be here, because I'm enjoying every moment. Because again, I never know when the next thing, in a twinkling of an eye, I was gone. And I never know when that's going to happen again, so I'm going to enjoy every moment. Loving every minute of it.
Yeah. I thank you. You're welcome. You're welcome.
Thank you, Mr. Hayes and Dr. Tracy. Well, this is a celebration of courage and care, Cardiac Event Survivors Day, February 19th, for demonstrating courage in the face of adversity. Mr. Hayes.
Thank you. I'll have Dr. Tracy hold it.
Come over here.
Well, thanks everybody for coming here and celebrating tonight with us. Tonight was more than just a gathering. It's about celebrating the extra chapters of the stories we heard tonight. While I'm honored to stand here, I always say once in a while I have a good idea. This time, the good idea came from Dr. Choi to do this event, hopefully the first event, and we hope that it can sustain the years. And we have to thank Carmen Stoll, I think, because she was the past president of the GW Women's Boards for many years, and she did organize the annual golf tournament, I think, for 22 years or so. And Carmen was the one that called me and said, hey, we have this fundraiser event, the golf tournament, and we want you to be the recipient of the awards, and we want you to plan some events. And then everything started with me and Dr. Choi and the Heart and Vascular Institute, thanks to the support to Dr. Pandrath and everybody. I think I want to also thank Susan Duberstein for the big effort of putting this together. I think we don't realize how much effort the Heart and Vascular Institute is doing, but Susan is sort of the driving force now, and we're here because she put this all together and made it happen. Thank you, Susan. I think I was asked, what is it that we do about this cardiac events and cardiac arrhythmias, and how did we contribute? But I think we have worked on this for years, and I think we're very proud that, for example, we have trained the paramedics of the city of how to do highly effective CPR and make sure that they're doing the right thing. We have also worked with the medical students for 25 years now, teaching the class on ventricular fibrillation, how to do. I always teach them about the epinephrine and the shocks and how to make the patient survive if you're the one faced with a cardiac arrest event. We're fortunate enough to have a very active biomedical engineering department, and we have worked with them on developing the new technology. I think for years, I was a biomedical engineer at the beginning, and for years we've been working with, for example, with Igor Efimov at GW to help develop the new tools and technology that are going to be used in the future. And I'm very proud that I'm in charge of training the fellows now. So we have trained Chris and Doris how to put defibrillators in patients and how to manage them over time. And worked in the lab with Kay and Kevin, checking over 1,800 devices that we monitor every day. Essentially, people call, something happened, there's an event, this and that. We adjust all the defibrillators. And also, when I came to GW, I think one of the best things when I started working with Dr. Reiner is he invited us to help train the city on how to use the automatic defibrillators, and we donated, the Heart and Vascular Institute, together with Dr. Reiner, donated many of these AEDs that were placed in different churches and different places throughout the city to hopefully, have some impact. And if somebody were to have ventricular fibrillation somewhere, the people are trained on how to use the devices and how to treat them. We're fortunate to work at a facility like GW Hospital that provides us with world-class tools, and thanks to Dr. Patty Knox, who I have known since my internship, right? You were intern the same year. And thank you for working at the hospital and keeping us able to do our work. I want to thank Dr. Tracy, Dr. Reiner, and Dr. Mashari for being here, for their leadership in pushing the boundaries and helping us achieve what we can do. Even the most sophisticated technology in the world cannot replicate the resilience we have witnessed tonight. I think our patients are the most important thing in our world. And your stories remind us that our work isn't measuring heartbeats, but in the moments those heartbeats allow, and the time spent with the friends, the families, and the loved ones. We hope that we have been able to achieve that. It is our hope that this becomes a tradition that stands the test of time. Thank you for trusting us with your care and for inspiring us to keep striving. Good night, and here's to many more years of health and happiness.